Hello, I'm Dr. Michael Hart, and if you constantly feel mucus sitting in the back of your throat, I want you to pay close attention today, because that sticky feeling may not be coming from where you think. Many people assume it must be a cold, others blame allergies. Some believe it is simply post-nasal drip, and many older adults eventually tell themselves, maybe this is just part of getting older. But what if you keep treating your nose, while the real problem is coming from somewhere completely different? Here is a quick question. Do you clear your throat again and again throughout the day? Maybe you make a small sound like this, ahem. Then 5 minutes later, you do it again. You drink water, you swallow, you cough, you clear your throat. For a few seconds it feels better. Then that sensation returns. A coating, a lump, a sticky feeling. Something that seems to sit exactly where you cannot reach it. If that sounds familiar, stay with me, because today I'm going to explain several possible causes of persistent throat mucus, and one of the most overlooked possibilities may surprise you. But first, I need to clarify something important. Persistent mucus is not one disease. It is a symptom, and that distinction matters. Your throat can feel coated or congested for many different reasons. Allergies, post-nasal drainage, chronic sinus inflammation, respiratory infections, dry air, smoking, certain medications, swallowing problems, and sometimes reflux. So if anyone tells you that every case of throat mucus has one single hidden cause, be careful. Human biology is rarely that simple. But there is one condition that deserves attention, particularly when mucus continues for weeks or months and traditional allergy treatments do not seem to solve the problem. It is called laryngopharyngeal reflux, often shortened to LPR. You may also hear people call it silent reflux, and here is why it confuses so many people. You can have throat symptoms without obvious heartburn. That is the part many people miss. Most of us hear the word reflux and imagine a burning sensation in the chest after a heavy meal. But throat-focused reflux symptoms can look different. Instead of classic burning, some people report frequent throat clearing, hoarseness, a chronic cough, a sensation of something stuck in the throat, excess mucus, a sour or unpleasant taste, or symptoms that seem worse after meals or when lying down. Now imagine what happens next. A person develops mucus. They assume allergies. They buy an antihistamine. Maybe it helps a little, but the problem returns. Then they try a nasal spray, then a humidifier, then herbal tea, then another allergy medicine. Months pass, sometimes years, and nobody asks a very simple question. Could material from the stomach be contributing to irritation higher in the throat? Let me explain the basic idea. Your stomach is designed to handle an extremely harsh chemical environment. Your throat is not. Between your stomach and esophagus is a muscular barrier that helps limit backward movement of stomach contents. But reflux can occur, and when reflux material travels upward, it may irritate tissues higher in the digestive and respiratory tract. The throat and voice box are sensitive. Repeated irritation may contribute to swelling, discomfort, coughing, throat clearing, and the sensation of mucus. But here is where things become even more interesting. Acid is not the only substance researchers discuss in relation to LPR. There is also a digestive enzyme called pepsin. Pepsin normally helps digest protein in the stomach. That is exactly where you want it. The concern is what may happen when stomach contents travel upward and expose tissues that were never designed for repeated contact with digestive material. This is one reason researchers continue studying the role of reflux components in persistent throat and voice symptoms. But I want to be medically responsible here. Finding throat mucus does not automatically prove you have LPR. And having no heartburn does not automatically prove you have silent reflux. Diagnosis can be complicated, because many throat symptoms overlap with other conditions. That is why self-diagnosis can become a problem. Now, I want you to do a quick personal check. Ask yourself these questions. Is your voice more hoarse in the morning? Do you frequently clear your throat after eating? Do you feel a lump even when food is not actually stuck? Does your cough become worse after lying down? Do late dinners seem to make the next morning worse? Do you sometimes wake with an unpleasant taste in your mouth? Does your throat feel irritated, even though you do not have a cold? If several of these sound familiar, reflux is one possibility worth discussing with a qualified healthcare professional. But there is another clue I want you to notice. Timing. Timing can tell us a lot. Suppose you eat a large dinner at 9:30 at night, maybe fried food, a rich dessert. Then you sit on the sofa. At 10:30 you go to bed. You lie completely flat. Now think about the mechanics. Your stomach is still processing a large meal. You are no longer upright. Gravity is no longer helping in the same way. And depending on your individual physiology, reflux may become more likely. Then morning arrives. You wake up. Your throat feels coated. Your voice sounds rough. You clear your throat repeatedly, and you blame the weather. But the pattern may have started with what happened the night before. This is why I often encourage people to stop looking at symptoms as isolated moments. Your morning throat may be telling you something about your evening routine. Now here is one of the biggest mistakes people make. They clear their throat aggressively all day. Ahem. Again. And again. And again. It feels logical. There is mucus, so you try to remove it. But repeated forceful throat clearing can itself irritate sensitive tissues around the voice box. Then irritation creates more sensation. More sensation creates more throat clearing, and more throat clearing may create more irritation. You can become trapped in a cycle. Mucus sensation, throat clearing. Temporary relief, more irritation, more sensation, more throat clearing. So what can you do instead? When appropriate, try a gentle swallow. Take a small sip of water. Avoid repeatedly forcing the throat clear with maximum intensity. And if the problem persists, investigate the underlying cause instead of spending years fighting the symptom. Now, I need to tell you about another possibility that is often confused with excess mucus, because sometimes the problem is not that your body is producing enormous amounts of mucus. Sometimes your mouth and throat are too dry. That sounds contradictory, doesn't it? How can dryness feel like mucus? But think about it. When saliva production decreases, secretions can feel thicker. Swallowing may feel less smooth. The throat can feel sticky. You become more aware of every sensation. And you may interpret that thickness as mucus. This becomes particularly important in older adults because many commonly used medications can contribute to dry mouth. Some antihistamines, some antidepressants, some medications used for bladder symptoms, and other medicines with drying effects. So imagine this situation. You feel mucus. You assume allergies. You take an antihistamine. The medication dries your mouth. Your secretions feel thicker. You clear your throat more. And now you believe your allergies are becoming worse. Do you see how easily this can become confusing? This is why guessing can keep people trapped for years. And we have not even discussed the nose yet. Because yes, sometimes the problem really is post-nasal drainage. The nasal passages and sinuses naturally produce mucus. With allergies, infections, irritation, or chronic inflammation, drainage can become more noticeable. Some people feel it moving down the back of the throat, but here is the key point. If you have spent months treating presumed allergies with little improvement, it may be time to reconsider the diagnosis rather than simply buying a stronger version of the same treatment. And in a moment, I'm going to show you a simple pattern that can help you think more clearly about whether your symptoms seem more connected to the nose, dryness, reflux, or something that deserves faster medical attention. because there are certain warning signs that should never be dismissed as just mucus. And one of them is especially important if you are over 60. The first warning sign is difficulty swallowing. If food repeatedly feels stuck, if swallowing becomes painful, or if liquids frequently go down the wrong way and trigger coughing, do not simply assume mucus is responsible. Persistent swallowing difficulty deserves medical evaluation. The second warning sign is unexplained weight loss. If you are losing weight without trying, especially alongside persistent throat symptoms, voice changes, reduced appetite, or difficulty swallowing, speak with a healthcare professional. The third is blood. Coughing up blood, vomiting blood, or seeing blood repeatedly in saliva should never be casually blamed on throat irritation. And the fourth warning sign is persistent hoarseness. A rough voice after a cold may be temporary, but a voice change that continues for weeks, especially in someone who smokes or previously smoked, should be properly evaluated. Remember this: common symptoms can have uncommon causes. That does not mean you should panic. It means you should not ignore a persistent change simply because it seems minor. Now let me give you a practical way to think about your symptoms. If the problem seems more connected to the nose, you may notice sneezing, nasal congestion, itchy eyes, seasonal changes, or a clear sensation of drainage from the nasal passages. That pattern may point more toward allergies or nasal inflammation. If the problem seems more connected to reflux, you may notice symptoms after large meals, late dinners, lying down, or certain trigger foods. You may also experience morning hoarseness, frequent throat clearing, a lump sensation, cough, or an unpleasant taste. If dryness is playing a role, you may notice a sticky mouth, difficulty speaking for long periods, increased thirst, thick saliva, or symptoms that became worse after starting a new medication. And if symptoms began suddenly, with fever, body aches, significant throat pain, or other signs of illness, infection may be more likely. These are not diagnostic rules, they are patterns. And patterns can help you have a better conversation with your doctor. Now let's talk about what you can actually do. The first step is surprisingly simple. Track when the mucus is worst. Not just whether you have it, when. Is it worst immediately after waking? After coffee? After dinner? After dairy? After spicy food? When lying down? During allergy season? After taking medication? In air-conditioned rooms? This information can be incredibly useful because symptoms without context are difficult to interpret. But symptoms with timing begin to tell a story. The second step is to examine your evening meal. If reflux may be contributing, eating a large meal shortly before lying down can be an important pattern to address. Try allowing more time between your final meal and bedtime. For many people with reflux symptoms, avoiding meals within roughly 3 hours of lying down may be helpful. But do not turn this into an extreme rule. You do not need to starve yourself. You need to observe your own pattern. And pay attention to portion size. Sometimes people become obsessed with one food. They say, tomatoes are the problem, coffee is the problem, chocolate is the problem. But then they eat an enormous dinner and lie down 40 minutes later. The amount of food can matter too. A very large meal increases stomach distension and may worsen reflux in susceptible people. So before eliminating 20 foods from your diet, examine the basics. How much are you eating? How late are you eating? And what happens afterward? The third step is to identify your personal triggers, not someone else's triggers, yours. Commonly reported reflux triggers can include high-fat meals, alcohol, chocolate, caffeine, mint, spicy foods, and acidic foods. But not every person reacts to every item. This is important because overly restrictive diets can become unnecessary and difficult to maintain. Instead, look for repeated patterns. If every time you eat a heavy fried dinner at 9 p.m, your throat is worse the next morning, that pattern matters. If coffee causes no symptoms at all, that is also useful information. Observe before you eliminate. The fourth step is to reconsider how you sleep. Some people with nighttime reflux symptoms may benefit from elevating the head of the bed. And I do not mean stacking 5 soft pillows under your neck until you wake up with back pain. The goal is to elevate the upper body more effectively, often with a wedge or appropriate bed elevation. But again, individual medical conditions matter. What works for one person may not be suitable for another. Now here is another practical point that almost nobody discusses. Your body position after eating. You finish dinner, then immediately collapse onto the sofa, or lie in bed watching television. If reflux is part of your problem, remaining upright after meals may be a simple habit worth trying. Take a gentle walk if appropriate for you. Sit upright. Give digestion some time before lying flat. Small changes can sometimes reveal useful patterns. Now let's return to hydration. Water is not a magical cure for chronic throat mucus, but inadequate hydration can make secretions feel thicker and may worsen dryness. For many people, drinking appropriate fluids throughout the day supports normal saliva and mucus function. However, if you have heart failure, kidney disease, or have been given a fluid restriction, follow your healthcare professional's instructions. Do not force excessive water because someone online told you to drink 3 or 4 litres a day. More is not always better. Appropriate is better. Now, what about dairy? This is one of the most common questions. Many people believe milk automatically causes the body to produce huge amounts of mucus. The reality is more nuanced. For some people, dairy can create a temporary sensation of thicker coating in the mouth and throat. That sensation may feel like increased mucus, but this does not mean dairy is the universal hidden cause of chronic throat mucus. If you personally notice a consistent connection, discuss it with a healthcare professional or test the pattern thoughtfully. But do not remove major food groups permanently based on fear. Now here is something else I want you to avoid. Repeatedly starting acid-reducing medication on your own simply because you watched a video about silent reflux. This is important. Persistent throat symptoms can have multiple causes, and throat symptoms alone do not prove that stomach acid is responsible. If symptoms continue, a doctor may consider your history, examination findings, medication use, nasal symptoms, reflux pattern, and sometimes additional testing or specialist evaluation. An ear, nose and throat specialist may examine the throat and voice box when appropriate. A gastroenterology evaluation may be considered in selected cases. The goal is not to collect as many medications as possible. The goal is to identify the most likely cause, and please remember that even when reflux is involved, throat symptoms may not disappear overnight. Irritated tissue can take time to settle. That is why changing one habit for 2 days and declaring it a failure may not tell you very much. Consistency matters, but so does reassessment. If you follow a reasonable plan and nothing improves, do not keep repeating the same strategy for another year. Reconsider the diagnosis. Now I want to give you a simple 7-day observation challenge. For the next week, write down 4 things. When your throat mucus is worst. What you ate in the previous few hours. Whether you were lying down. And whether you had nasal symptoms such as sneezing or congestion. That is all. You may discover something surprising. Maybe your symptoms consistently worsen after late meals. Maybe they are strongest during dusty weather. Maybe they began after a new medication. Maybe they are worse on days when you barely drink. Maybe there is no clear pattern at all, which is also useful information and may strengthen the case for proper medical evaluation. Your body often gives clues, but clues are easy to miss when every day blends into the next. Now let me bring everything together. Persistent mucus in the throat can have several causes. Sometimes it is allergy-related. Sometimes nasal drainage is responsible. Sometimes dryness makes secretions feel thick and sticky. Sometimes medication contributes. Sometimes reflux may be involved, even when classic heartburn is absent. And sometimes persistent throat symptoms need further investigation because something else is happening. The most important message is not, you definitely have silent reflux. I cannot diagnose you through a video. The real message is this: do not spend years treating the wrong problem simply because the first explanation sounded familiar. If your mucus has continued for weeks or months, if you are constantly clearing your throat, if your voice is changing, if swallowing is becoming difficult,